All right, good afternoon. This is a lecture about back pain, and it's really designed to allow you to understand the differences between frameworks of understanding back pain as a functional condition versus back pain as a structural condition. So this is the disconnect that we're trying to unravel, which is a situation that I see very frequently in my medico-legal practice. I see patients who have a work-related injury. They have severe pain and disability, often for a very long time. The onset of their pain and disability occurred acutely. It remained and continues to remain persistent with lots of secondary problems developing over the time course, and the final conclusion by the expert assessor, often a spinal surgeon, neurosurgeon, orthopaedic surgeon, occupational physician, musculoskeletal physician, pain specialist, 0% impairment. So this is something that I wanted to really understand in a clinical and medico-legal framework. So where have we gone wrong? Have we gone wrong? So let's go backwards to unravel this a little bit. And we're going to talk about fundamentals of medical practice, fundamentals of medicine. Now, do you think it's appropriate to label severe asthma as shortness of breath syndrome, retrosternal chest pain syndrome, when in fact it may be myocardial ischemia, headache syndrome, when it may be migraine, back pain, well, when it's back pain, all right? So it's clearly not okay with these other conditions if someone has asthma, if someone has ischemic heart disease, if someone has migraine, but when it's back pain, we continue to call it back pain. That's a disconnect. That doesn't make sense. So in medicine, back pain is very often used interchangeably and incorrectly as both diagnosis and symptom. On doctor certificates, sick leave because of back pain, insurance reports, motor vehicle accident, diagnosis back pain after the accident, expert assessments, diagnosis back pain. In research, one of the most commonly quoted papers that is used throughout back pain research literature is this one in the Lancet, and the title is Non-Specific Low Back Pain, and I've highlighted in yellow. Because non-specific low back pain does not have a known pathoanatomical cause, we can just switch off our brains and regard back pain as both symptom, which is what pain is, and diagnosis, which of course is fundamentally flawed. And if you have a fundamental flaw, everything that you build upon that fundamental empirical model of a condition is likely to also be flawed, like a house of cards. So in surgery, I had surgery for back pain, or I had back pain surgery. Surgery is a purely structural intervention. Pain is a functional state. You cannot cure a functional condition with a structural intervention, okay? Even if patients might say, yes, my back pain symptoms improved after the structural intervention of the surgery, somewhere along the line, the functional problem has been addressed. The surgery has merely reversed a structural deficit in the spine. So imagine I had a lung transplant for shortness of breath. I had a coronary stent for chest pain. I'm having antibiotics for a fever. No. I had a lung transplant for emphysema because my smoking gave me emphysema. I had a coronary stent for eating too much sugar and developing atherosclerosis. I'm taking my antibiotics for the bacterial pneumonia. Imagine how well we would do at treating these conditions, these very common conditions, if we did not know that smoking caused these symptoms and conditions, if we did not know sugar caused that, if we did not know that bacteria could cause pneumonia, we would be very, very bad at treating those conditions. So imagine if we go through our spine care and treat back pain, but do not understand the functional cause for back pain. How well do you think we are going to do? What are the statistics going to show? Well, here they are. Back pain is considered by many as the leading cause of disability on the planet. Even the WHO, even though it's now defunct. Low back pain is the single leading cause of disability. They won't be able to come up with statements like this because they no longer have funding, which is probably not a bad thing. The leading cause of clinical and economic disease burden. The opioid crisis. We all talk about the opioid crisis. It's in the Sydney Morning Herald every day. Is the back pain crisis. It's not cancer pain. It's not foot pain or hip or knee. It's the back pain crisis. If back pain was treated effectively at the root causation level, we would not have an opioid crisis. Okay? We may still have people abusing opioids illicitly, but we wouldn't have a medically, iatrogenically induced back pain crisis. Our Australian Burden of Disease study, which is performed every 5 years or so, shows worsening progress at addressing back pain, not improving. At least other conditions are getting better, but the statistics show that the rehabilitation industry is actually getting worse. We're performing worse with our back pain recovery statistics and all of the other metrics, such as quality of life, years, and return to work and those types of things. And it is not related to age. So what is low back pain? And even more simply, what is pain and what causes pain? A lot of specialists and experts, they like to complicate pain. It does not have to be complicated. Pain is a symptom. We have causations. It's quite simple. Here's an example of that complexity. Unraveling the complexity of low back pain. You've got to understand all of these factors. You have to be a surgeon, you have to be a psychologist, you have to be a pain specialist, you have to be a rehabilitation specialist, you've got to be a radiologist. If you can ever have, according to this model, if you're going to have any chance of resolving this mystical, complex low back pain condition that affects millions upon billions of people. So this word should be unraveling the simplicity of low back pain. Right? And if you think about this epidemic condition, by definition, if a condition is going to reach epidemic status that affects people all around the world in a ubiquitous manner, there must be a simple root cause. If there were not a simple root cause, the condition would never have reached epidemic status in the first place. So this is pretty simple for everyone to understand. Injury causes pain. Do you think that's going to hurt? Do you think that little kid's going to be crying to his mum and dad? Yes, he is, because he's sustained an injury, okay? A force applied to the tissues that results in pain. Now, oops, sorry, that circle needs to be adjusted. One critical factor that's mostly ignored. Who's in trouble? Who's going to be feeling pain? The critical factor is stability, because stability determines whether the forces associated with your body, with your spine, with your back structures, whether those forces can actually inflict an injury.